Hello students, today's video lecture is going to be on the muscles that move the head and neck. The first thing that we want to do is come up with our 4 movement options because we know that some of the vocabulary we've learned previously doesn't apply to the head or the neck. So that's our first task. Let's brainstorm the 4 ways that we can move the head and the neck. So I've listed here we're able to do flexion where the head tips forward, extension where the head tips backwards. Then we can also do lateral flexion where the head tips to the right side or the left side. And just FYI, there is no medial flexion, that doesn't exist. So it's lateral flexion to the right or the left. And then finally, we have the option of right or left rotation where you literally turn your entire head to look to the right or look to the left. So now that we know our movement options, let's go ahead and get started. The 4 muscles that we're going to learn that move the head and the neck will do combinations of these. So the first one that we're going to focus on is this one right here, and that is called the sternocleidomastoid. So I'm going to switch screens and we'll take a look at the information for the sternocleidomastoid. You'll notice sometimes I also abbreviate it SCM all in caps because let's face it, that's a lot of letters. So for the sternocleidomastoid, the 2 origins and the 1 insertion are in the name. That's where this massive name comes from. So we have the mastoid process represented. That's this bump behind the ear. You can see that in the word here. And then we also have the sternum. And Cleido is referencing the clavicle. So these are muscles that move the head and the neck. So we know that the head neck is going to be the moving end or the insertion. The insertion is always the moving end. The other 2 ends will be the origin because sternum doesn't really go anywhere. So that's kind of a given. So 2 origins, the manubrium of the sternum, represented in the name, and the sternal end of the clavicle. Cleido, again, is the clavicle portion in the name. The insertion is the mastoid process of the temporal bone. So let's take a look at our anatomy atlas for a little bit better view of this. So here's the sternocleidomastoid on the anatomy atlas. I've removed every other muscle and just left that. Sometimes you'll see a little bit of a split here between the sternal head of the muscle and the clavicular head, sometimes not. So just be aware it's presented a little differently, but you should always be able to notice it's attaching to the sternum and clavicle on the lower end and to the mastoid process on the upper end. So if we put in our O and I for this, the O is going to be here and here. That's the origin or the anchored side. The insertion is going to be up on this side by the mastoid process, and we're going to get a downward arrow as we follow the rule of muscle contraction, always, always. I moves closer to O. So the real question is, what actions are accomplished by the sternocleidomastoid? And the answer is 3 out of the 4 options that you have in your notes are accomplished by the sternocleidomastoid. The catch to that is if we utilize only one side, let's say we utilize the left side or the right side and not the left, we only use one side, we're going to get 2 different options there. But if we use them both together, we'll get a 3rd option. When they work simultaneously and pull on both sides of the head at the same time, it'll produce a totally different action than if we only use one. So the question is, what are the actions for the sternocleidomastoid? And the answer is that if we use one side, the left side or the right side, all by itself, we'll get the option of rotation. It will pull the head towards the opposite shoulder. So if we use this side of the body, this mastoid process behind your ear is pulled closer to the front, which causes the head to turn toward the opposite side. So for example, this is the left sternocleidomastoid, but when you contract it, it actually makes your head turn to the right. Another option besides rotation for this unilateral contraction would be to pull the mastoid process closer towards the sternum and clavicle by doing lateral flexion towards the same shoulder. So it can, depending on what other muscles are doing, it can also tip the head to the same side. So rotate towards the opposite side or tip towards the same side. What would we get if we used both sides at the same time? And that's called a bilateral contraction. The answer is neck flexion. It will pull both sides equally towards the origin, which is in the front, which is going to cause the head to tip towards the front of the body. So that's called neck flexion. So back to our anatomy atlas, and this will show you the neck flexion. Head tips towards the front, and in this case we can see that the mastoid process is now pulled closer to the front side of the body. If we were to tip our head towards the back and do extension, it would actually be elongating this muscle, and we know muscles shorten with contraction. So sternocleidomastoid causing neck flexion. Here's the animation of lateral flexion. We can see that this side would be contracting to pull the mastoid process down, and now this side will be contracting to put the head back into the anatomical position. If we wanted to tip to this side would contract more completely. So here we're seeing the rotation. Now the question is, which side is contracting? Let me get him into the middle here. He's turning to the side. Let me stop there. This is now closer to the front. This insertion point here is now closer to the origin point at the bottom. So let's watch again. This is not during contraction, but here's the contraction. This muscle is shortening and pulling, causing the head to turn towards the opposite shoulder. So all these are actions for the sternocleidomastoid. The second muscle on the first page of the notes is going to be right across the way here. And actually it's 3 different muscles, but we're going to talk about them in terms of being a group. And so what we have here is the scalenes group. We have an anterior scalene, a middle scalene, and a posterior scalene. And all 3 of those are again represented here. So I'm going to go ahead and label those and we'll take a look. Now, keep in mind, we have scalenes on both sides, sternocleidomastoid on both sides. So this is going to be sort of tucked in behind the sternocleidomastoid. But keep in mind, it has a more posterior insertion and a little bit of a more anterior origin, very similar to the sternocleidomastoid. So let's take a look at the PowerPoint. So here gives you reference where this piece right here is the sternocleidomastoid, and then tucked in this little area right here between sternocleidomastoid and our trapezius are the scalenes group. So this is what you'll get from a surface view. You can also see over here on this girl, here is her sternocleidomastoid. Here is her trapezius, and this vacancy between those is where the scalenes are. Now, this is a anatomical importance for a lot of people because they end up having sometimes issues with the nerves that come through the scalene group and go out to the arm. So if these muscles get especially tight, it can actually cut off some nerve supply to the arm, and you'll get numbness, tingling, pain in the arm, or even disuse. So that's why it's of anatomical importance. A lot of issues originate from this area here, which is why they sort of call it the Bermuda Triangle. We have a lot of, if you know the history of the Bermuda Triangle, you know there's a lot of issues there. So what I've written here for actions are that these are helpers to the sternocleidomastoid. And so they're going to allow rotation of the neck, just like SCM. Lateral flexion of the neck, this is if we're using only one side, unilateral contraction, and then if we use bilateral contraction, we're going to aid in flexion of the neck. So these are the exact same actions of sternocleidomastoid. And again, they're going to be in this vicinity here between sternocleidomastoid and another muscle that we're going to learn in just a little bit called trapezius. So on this slide, it sort of shows you how the nerves and also blood supply, check that out, that are going to the arm kind of weave through those scalene muscles. So here's your anterior scalene and your middle scalene. We have a pretty good opportunity to shut off some of these major important structures by having muscles that are overly tight. So that's of really significant anatomical importance. Finally, for the pair, I have some images here just to help you understand their actions a little bit better. So you can pause the slide here. I do want you to remember that sternocleidomastoid and scalenes do the same action. So I want you to kind of group those together in your mind. One last thing I want to point out before I show you them on the atlas is this word here, contralateral means. Contra means opposite. So it's going to turn, it's going to do rotation to the opposite side. So if you use the right muscle, it will turn you to the left side. So let's take a look at our atlas. So you'll notice I have some muscles pulled up here that are in the same vicinity as the scalenes. First off, we've already learned this muscle here. I'm hoping you remember it from our facial expression group. And this muscle is known as the platysma. So notice that is the most superficial in this region, and it's very broad. But I'm going to go ahead and hide that since we're not concerned with that at this point. Here is the sternocleidomastoid, and I'm going to go ahead and hide that one as well because the scalenes are tucked in underneath there. So then, as you see, we have the anterior, middle, and posterior scalene tucked underneath there. Now, what happens if I add in my nerves? We get to the nervous system, and you can see, just like that picture I showed you, how those nerve branches are coming right between anterior and middle scalene. So if we have issues here, we can add our blood supply as well. Look, major vessel running between anterior and middle scalene. So this is a really complicated area. There's problems there. So that is the scalenes. Let's move on to our next page. On our second page, the last two muscles are presented, and the first one in this pair is known as the splenius. Now, technically, there are two muscles here. We've got a splenius capitis, which comes to the head, and splenius cervicus, which runs from the neck. Both of them are coming down to the vertebral column, but we can go ahead and just call this the splenius group, and let's talk about their actions. Okay, so we've come over to the PowerPoint. You can see the spelling here. I'll show you in just a minute how most of this muscle is deep to a larger muscle that's more superficial called the trapezius. So like I mentioned, there's technically two sections to splenius. I don't necessarily need you to differentiate, but we have splenius capitis and splenius cervicus. Now, which end of these is going to move? Think about the section that we're in right now. These are the head movers. So the upper portion is going to be the insertion point. Insertion is always the moving end. The lower section will be the origin. So here's a case where we also have this particular muscle being capable of 3 of the 4 options that we originally discussed. So the question is, flexion, extension, lateral flexion, rotation. Which one is this muscle not capable of? Let's take a look in the atlas. So I have both splenius isolated here. Splenius capitis, splenius cervicus, same on the other side. So out of flexion, extension, lateral flexion, and rotation, it's capable of 3 of the 4. So it's almost easier to try to eliminate a choice. Would this muscle be able to do, let's say, extension? The answer is yes. If we pull from both sides equally, bilateral contraction causes extension as the head tips back. What about lateral flexion? What if only one side pulled? It is going to pull this area just behind the mastoid process down towards the collarbone, so that would cause lateral flexion, so that's an option. What about rotation? Would a single side be able to cause rotation as this part was pulled closer to this? The answer is yes. The only option that splenius does not do is flexion. And actually, if you did neck flexion, you would be stretching the splenius muscles. So the three actions for the splenius, the insertion end on the head gets pulled closer to the origin end on the vertebral column are rotation of the head neck, that's one side contraction, unilateral. Another unilateral option is lateral flexion. And then a bilateral contraction would cause extension of the head neck area. Finally, let's move on to our last muscle called the trapezius. The trapezius is here in yellow. It's one of our largest muscles in the upper sort of back neck area. And I'm going to go ahead and draw in the origin and insertion for this head neck mover, and you can choose what you think it is capable of. So I've added the I and the O to my diagram. And it seems like there's a lot of muscle we're not going to be using here, but this is also a scapula mover, so we'll see this one again in our next section. If we draw our arrow in from I to O, remember that's always the movement rule. The insertion end is pulled closer to the origin end. What action will be caused for the trapezius? And the answer is neck extension. The trapezius also causes neck extension. So both of these posterior muscles are extenders. Let's head over to the atlas and finish up. Finally, in the atlas, you can see the trapezius here. And then underneath the trapezius, you'll notice, if I delete that, we have the splenius here and also here. So you notice I'm leaving all these muscles on here. It's getting pretty complicated. So we're going to have some practice where you're going to have to label from a superficial view. Again, here's splenius, capitis, and cervicus, and both of these would be situated underneath the trapezius. So from this side, trapezius all the way up to occipital bone, splenius, capitis, and cervicus. As we continue to turn, we'll see sternocleidomastoid, and then we'll also have our scalenes tucked in that little section there. Oops, there's the last one right there. See you next time.